So now we go on to the session that was on ethics. We couldn't have it at that time because there was some device issue. So Dr. Priyanka is here. Dr. Priyanka, can we try for your session now?
Good afternoon, sir. Extremely sorry for the problem earlier on. I've tried to log in through a different device. I hope I'm audible now.
Yes, perfect.
Okay, sir.
Dr. Priyanka, you are sharing your screen right now. So if you can open the PowerPoint, click on the PowerPoint slide. If that comes on the desktop, your desktop is being shared.
Okay, sir. I'm just trying to do that.
I am seeing your Teams screen right now.
Right, sir. Right, sir. I'll open my PPT now. Sir, is my PPT visible now, sir?
Not yet. It is. The screen seems to dark to me, but sometimes this happens in my. Is the screen visible to others?
No, it is not visible.
Not visible. Stop sharing and start sharing again, Dr. Priyanka.
Okay, sir. I'll do that again.
Again, your Teams screen is.
So is it visible now?
Your Teams screen is visible.
Okay, sir. So is the PPT now visible?
No, I don't think why it is not visible.
I think I'm doing some.
Now this Microsoft Teams.
Wrong, sir, then.
Now Microsoft Teams. When it is displaying Microsoft Teams, why is it not displaying the PowerPoint?
Sir.
You're clicking on share and then you are sharing your screen or window.
Sir, I'm clicking on the desktop window.
You're clicking on no, don't click on desktop window. You click on the
Right,
PowerPoint. You click on window. You click on window, and then there will be 4 or 5 windows below, and
Right,
you
sir.
click on the PowerPoint.
Right, sir. Now it's showing, sir. Is it showing now, sir?
Excellent.
Right.
Yes.
Good afternoon, everyone. Yeah. So my topic for today's lecture is on ethical considerations in thesis protocol. I will be just giving you an overview of what you are supposed to do in your protocol submission. A more detailed lecture will follow later on, which will be taken by Member Secretary of the IEC, Dr. Rumpa ma'am. Before starting the lecture, I would like to acknowledge the contribution of Dr. Pooja Diwan ma'am, who has very kindly consented to share her slides. Most of the slides today would be hers with slight modification on my part. In today's session, I will be talking on the principles of ethics in research, just to give you a brief idea of why the protocol should go through the institutional research committee, ethics committee. And then the crux of the lecture would be on the components of the IC document, which you are supposed to submit along with your research proposal. So I will be highlighting mostly on the informed consent document, right? And then at the last, I'll be talking about the checklist, which needs to be seen so that all the documents are in place for your protocol submission. So there are four basic tenets of ethics in research. The first is autonomy, or the respect for persons. It represents the right of a person to make decisions about his life. And while we are doing a research, we are supposed to respect that right. So that is what autonomy stands for. Next is beneficence, which basically means that we aim to do good. And then and we try to minimize as far as possible any harm which the participant or the community may incur during the process of our research. The third basic principle of ethics in research is non-maleficence. That is, first, do no harm, right? So we should take all steps to minimize harm during the research process. And if there is any possibility of any harm, then we should take all possible steps to minimize that harm. And the last is justice, which basically will come into play when you select your participants for your research. It states that every individual has an equal right to be included in the research work, right? So this talks about the inclusion part. So unless contraindicated, no individual should be denied the right to be included in a research study. So these are the four basic tenets which needs to be followed in any research involving human subjects. And the whole purpose of the ethical review is basically to see that all these rights of a participant are respected and they're taken into account while doing a research. Okay. So what happens when your proposal goes through an institutional ethics committee? Okay, the whole purpose of this is basically to see or to assess the benefit risk ratio. Okay, so the benefit of research could be direct or indirect, right? And it could be the level of the individual, it could be the level of the community or the society. Similarly, there is a risk which is inherent in any type of research, right? So the role of the ethics committee is to minimize the risk and to ascertain what merit could be derived from the research. And it is not a single point process. It is an ongoing risk benefit assessment. It's always an ongoing process. Okay. So as you can see, I won't go into details of this. Any research can be categorized into four categories based on how you plan to go about the research. Okay, based on your methodology, how you select your subjects, what you intend to do, all those things taken together will categorize your research into four groups. What is important here, you see that in none of the categories, so you have less than minimal risk, you have a minimal risk category, you have a low risk category and a high risk category. What is important is that nowhere is there no risk research. Okay, so inherent in any research is there is some risk. Okay, so and it is not on the part of the principal investigator or the co-investigators to decide in which category your research falls into. Okay, that is the work of the ethical committee. So even if you think that your research will have a minimal risk or less than minimal risk, even each proposal should go through the institutional ethics committee, and the institutional ethics committee will decide what type of risk your research will incur. Okay. The second most important part is informed consent. And that is what the form that you have to fill up, the IEC form, deals with this aspect. So a large part of this form will have will deal with this part of the research principle, that is informed consent. So what is an informed consent? Consent is an instrument of mutual communication, okay, between the researcher and the participant, right? And here, what are the principles which we take into account? The principle of autonomy, right? The participant's decision to either involve himself or herself in the research or not. So that is respected when we take a consent from the participant. Okay, it's a vital element of research and it is an active communication process. What the investigator is supposed to do here is to convey to the participant the whole details of the research proposal. Okay, and based on this information which is conveyed to the participant will then decide whether he wants to participate in the research or not. Okay, so the principle that is protected here, the ethics principle that is protected, is the individual's autonomy. So you have an informed consent document which needs to be filled up, and this involves three components. Number one, you provide all the relevant information to the potential participants. Secondly, you ensure that the information which you have conveyed to the participant is understood by that person. Okay, and after understanding whatever the proposal is all about, voluntarily the participant will decide whether he or she will participate or not participate in the research activity. Right, so there are three main components. You provide the information, you ensure that whatever information has been conveyed is understood, and thirdly, then voluntarily the participant will either decide to participate or not participate in your research proposal. So what are the prerequisites for consent? It should always be taken before starting the study. You cannot take a consent after you have already, taken the participant into your study. You've involved the participant in the study and then you're taking a consent. No, you should take a consent before you start the study. The language which is used in the consent form for the participant to understand should be in non-technical terms. It should be in simple local language which can be easily understood by the participant. In special situations, for example, if a participant is visually challenged, you can even use braille script. Okay, what is important is that the participant fully understands what you're trying to convey, what information you're trying to give to the participant. You have to ensure that the participant has the capacity to understand the research and then convey his or her decision, right? So in case when the participant is a young child, is comatose or is terminally ill, right? In those special situations, you have a legally appointed representative, which is called an LAR, who gives the consent on the behalf of the participant. Okay. Again, you have to make sure that if the participant or the LAR is illiterate, then you have the option of taking an impartial, a person who is not connected with the research and who is literate, and who can act as a witness to your to whatever information has been conveyed, and the participant then gives a consent. Okay, and you have to give adequate time to the participant to understand and ask questions or discuss with the family. It's not that you just go, you just give, and then you take the sign and that's all. No, you have to ensure that the participant understands, takes the time to understand whatever consent has to be given. Okay. It's always a voluntary consent. You cannot, under any circumstance, put pressure on the participant for inducement into your research. It is important that you maintain the privacy and confidentiality of all research participants, and under no circumstances should you give false assurances or you intimidate the participants. Suppose you say that agar aapne, if you have not participated in my research study, you will not get the treatment you deserve. Aapko karna hi hoga, participate, only then you will get the treatment. No, you cannot do that. Okay, there should be no influences that I will pay you this much rupees if you participate. This is also wrong. Ethically, it is wrong. Okay. So all these things should be refrained from. So participant may say, I do not understand anything, do as you deem appropriate. No. Again, you have to make sure that the participant understands the whole thing, the whole process, and then you say that you take the time to understand, only then you give your consent, right? So there are two parts of the informed consent document. The first is the patient information sheet, right? At the end of this lecture, I'll be showing you an example of my PG's this IEC form, where I'll be showing you how exactly that is filled up. But for general understanding, you have to first state the patient information sheet will contain the purpose of the research, why you are doing the research, description of the procedure, how you intend to go about it, how will it be done, who will perform it, where will it be done, what will be the duration, what will be the outcomes, okay, etc., etc. What could be the risk, discomforts, and benefits? It should be very clearly stated in your PIS, right? Any alternatives that the patient or the participant may have. Consequences of refusing to participate, that you have to state very clearly that even if you do not participate, your routine treatment will not be hampered. That statement should be particularly there in your PIS, right? So during the course of your research, there could be a risk for injury. Okay, so what will you do in such cases? So there should be a provision for compensation for injury, ancillary care, or payment for participation, right? Then you have to ensure that the confidentiality or the privacy of the participants will be maintained, and this is written down in your PIS, okay, that I will maintain your confidentiality, right? Again, another statement that should be a part of your PIS is that the participant will have the freedom to refuse or withdraw from research at any time during the course of the research. At the same time, the investigator may also terminate participation, and this should also be noted down in your PIS. If you intend to publish the findings of your research, that should also be written down in your PIS. And if suppose this is not there at the time of doing the research and later on you want to publish, you have to take a re-consent. Okay, so it's better that you take a consent at the time of doing this, before starting the research itself, right? You'll have to state also whether there is a possibility of stigmatization because of participating in the research. And lastly, but not the last part, is the context of the research team, as well as the members of the IEC, right? In case of any violation of ethical principles, so they will have the participant will have the contact numbers or the contact details of this people, right? So your PIS should be simple, it should be clear, it should be crystal clear. Everything that you intend to do should be crystal clear and should be written down appropriately, okay? And it should be complete in all respects. So types of consent could be written, could be verbal, electronic, or online consent. For all intents and purposes, for your thesis work, you have to have a written consent, okay? Blanket consent is not considered for your purpose. It has to be a very specific consent for a specific intervention procedure of research. During the course of your research, if there is some modification in your research plan, then re-consent should be taken accordingly, and it should be presented to the IEC again for approval, right? So you should understand that consent process is an ongoing process. It is not a one-point procedure. Who will obtain consent? For your thesis protocol, you are the principal investigator and you are supposed to obtain the consent. However, consent can also be obtained by the co-investigator or a designee of the principal investigator who is conversant with the proposal, but this is still controversial. For all intents and purposes, just to make sure that you are the person who is taking the consent, okay? This is for basically residents of pediatrics, where you deal mostly with children. So consent in children is a bit different. You take it, as I have told you, LAR is necessary when the participant is too young. So in research where there is minimal risk or low risk to the child, consent from one parent or LAR is sufficient. However, if it has more than minimal risk or has high risk, then from both parents you have to take consent. If one parent is deceased or unknown or incompetent, then one parent's consent will suffice, right? The PIS or the patient information sheet will also give information on impact on the research on the growth of the participant, the development, as well as the school attendance. This is extra that has to be written down in your PIS, right? So on studies on, suppose you're doing a study on child abuse or neglect, then there could be a waiver of consent by the parent or LAR. So in children between 7 to 18 years of age, we do not call it a consent, we call it an assent, okay? So assent implies basically the same thing. It focuses on the same ethical principle, which is autonomy, right? And rights of the children who is participating in the research. For participants aged from 7 years to 11 years, verbal assent in presence of the parent or the LAR is required. 12 to 18 years, written assent is required. So if a child becomes more than 7 years, suppose he was 6 years when you started the study, and during the course he has turned more than 7, then include the assent. It should be a written assent document. Waiver of assent is done in the special cases in where the child is cognitively impaired and it has reaches a significant benefit for the child's health, and it's the same as waiver of consent. It has to go through the IEC. Okay, everything has to go through the IEC. So waiver of consent could be, asked for in your research proposal if it meets the following points. Retrospective studies where the participant is de-identified, right? Then research of anonymized biological samples or data. In this case, a waiver of consent may be applied for. Surveillance studies can also have a waiver of consent. You can apply for a waiver of consent in these cases. This does not apply to your thesis work, so I will skip this. Next is, how do you document your consent? It is, as I have told you, it's a written informed consent, okay? So you have to take the signature or the thumb impression of the participant. If the participant or the LAR is illiterate, then you have to, as I've stated, unrelated impartial literate witness should be there. The researcher should sign on the consent form and the person obtaining the consent. You have to have the signatures of all these people with the date and time. And if the participant is institutionalized, then you have to take additional permission from the head of the institution for conducting the research in the premises. Okay. And it is always important that whatever consent that you have taken, always give a copy of the same to the participant. So if the participant is a patient, which in most of our thesis studies it will be so, so his records should carry a noting of having discussed the research with him or her in the presence of his spouse or guardian, and they had time to interact, ask questions, and then the consent to participate in research was voluntary. So this statement should be there in your PIS. Okay. This is audio-visual recording of consent. This is a special circumstances in which you are dealing with vulnerable subjects who are involved in clinical trials of new chemical entity or new molecular entity. In these cases, it is recommended by as per the Gazette of India, that you should have a procedure of providing information to the subject and his understanding of such consent, and this shall be maintained in an audio-visual recording by the investigator for record purposes. So that was all about consent. Your IEC document also has a part of privacy and confidentiality, where you will respect the right of the patient to his privacy, and it is an obligation on the part of the researcher to see that confidentiality of all the whatever information that you have gathered from the participant is maintained. Okay, so any publication, as I have told you, either you take a consent right at the beginning or a specific re-consent may be needed if it is not obtained previously. All biological samples that you have collected should have either coding or they should be anonymized, right? Only special circumstances, there are certain special circumstances where the data of a participant can be disclosed. For example, there's a threat to the person's or the community's life. In such cases, only the data of the participant can be disclosed. Otherwise, for all intents and purposes, you should always make sure that any information that you have gathered from the participant is always confidential and the privacy of the individual is always maintained. The fourth principle is justice. Here, it is basically how you select your participants. So we follow two principles. One is the utilitarian principle, where the greatest good for the greatest numbers is taken into account. And then you take the egalitarian principle, where the benefits and burden of research are distributed equally. Okay. This is basically justice, or the participant's right to be included in a research work, while at the same time, it is a duty of the researcher to make sure that you are not just involving, vulnerable participants to benefit others. So that is not done. So this is what distributive justice implies. So this, as you can see here in this cartoons, these are the vulnerable people who can be, they can be easily made to participate in a research work under influence, where they are basically incapable of making informed voluntary decision for themselves, right? So you should have plans for any direct or indirect benefit sharing in all types of research, including biological materials. This is a very nice book on the immortal life of Henrietta Lacks. If you've heard about the HeLa cell lines, you will know that this patient's cell lines were used for a long time, and many companies, they benefited a lot, but the patient's family came to know about 20 years later, and it did not, benefit from this. Okay, so this was against ethical principles. Payment for participation. So what the IEC document also has this part where you should mention about a reasonable reimbursement, and this reasonable means that the expenses which is incurred during the participants involvement in the research. For example, there's a loss of wage because the participant had to travel that day to come to your institute to give his samples. Okay, so this must all be reviewed by the ethical committee, right? And in no condition, under no circumstances, should participants be made to pay for any expenses which is incurred beyond the routine care and which are part of the research. So you have to do a suppose investigation and extra investigation, and under no circumstances will the participant pay for that investigation, right? That should be a part of your budget allotment in your research proposal itself, and the participant should not be allowed to pay for it. The sixth point is compensation for research-related harm. So the first thing that you should remember is that any serious adverse effect must be reported to the EC within 24 hours of its occurring, and with a detailed report within 14 days. And the EC will then determine the relatedness of the adverse effect to the research and will determine the quantum of compensation. For your research, the institution will provide compensation or insurance cover for the research-related injury. Seventh is the ancillary care. So basically, ancillary care are obligations which you do not need to do because of your research requirement, but which are considered in good faith. Okay, so there are no clear guidelines. There are 4 P's, which is positive obligation. There is planning. For example, you hire a physician, as part of your local study team, right? So that is an ancillary care that you can provide to your participant. A partnership with host community or local medical community, and practical provisions. So this should not be a part of your ancillary care. The 8th point is conflict of interest. There is a statement which is there in your IEC form where you should state whether you have a conflict of interest. This is basically situations in which you have financial or other personal considerations which basically may have the potential of compromising your research. Okay, So it could be at the level of the researcher, it could be at the level of the ethical committee, the sponsor, the institution. Whatever conflict of interest is there should be declared before starting your research and should be managed beforehand. Okay, and this statement should be very clearly written on your IC form that there is no conflict of interest. This I have already talked about, that about the vulnerable population. So they should be included only if the research directly answers their health needs, and they also have the right, as I have told you, justice. They have the tenet of justice. They have the right to be included in the research, but only if the research is directly answering their health needs. Post-research access and benefit sharing, I have already talked about. So whatever benefits from research is made should be made available to the community, individuals, or populations. It could be direct or indirect. And about the publication, there should be no falsification, no duplication, and authorship details have to be as per the article rules. A point about the clinical trials. So basically, whatever clinical trials that you're doing has to be registered with the Clinical Trial Registry of India. It is basically any research which involves new drugs on human subjects, right? So now we will be talking about the ethics review procedure. So who needs ethic review? All research on biomedical, social, behavioral sciences involving human participants, their biological material or their data. Okay, so all this research will need an ethical review, and all such proposals for research should be submitted to the Secretariat of the ICHR UCMS. The timing of submission will be informed. This is the checklist for submission. So the research proposal, both hard and soft copy, submitted to the IC must fulfill certain prerequisites. It should have a cover letter, number 1. Number 2, there should be clearance by the scientific committee. Third, the complete IC submission form, which is signed by the PI, the co-investigators, and which has an undertaking. And this is the link which can be downloaded from a college website. You do not need this recent CV of investigators. This is for later research proposals that you may do for your purpose. You do not need this. Then you have to have a complete research proposal, 13 copies, which will have objectives, the review of literature, justification. The methodology should be clearly detailed, right? But then the plan for statistical analysis, provision of ancillary care, and storage of data. All this should be included in your research proposal, and 13 copies of research proposal should be submitted. In case your research has more than minimal risk, how do you intend to manage the injury should also be a part of your proposal. Then you have the informed consent and assent document, which should both be in English as well as your local language, which for your purpose is in Hindi. Details of funding, if any, information about payments or compensation to the participants. Permissions. If you are using any copyrighted tools or you're taking anything from national bodies, the requisite permission should be included in your research proposal. If you're planning to do a multicentric study, then you have to have clearance from the other centers also. The IC clearance from the other centers where you're intending to do it should also be there. For clinical trials, you have to have the permission from the Drug Control General of India and documents in support of the safety of the new drug that you're intending to use. Plus, there should be clinical trial registration, as I've informed you. For internal collaborations, you do not need this, basically HMSC permission and statement of conflict of interest. So all this, are the checklists for when you submit your research proposal for IC clearance. So thank you for your patience hearing.
Thank you, Dr. Priyanka. You have given the an exhaustive presentation about all the things that are there in ethics committee when we submit a research proposal. For the protocol, I would like to tell the students that some of the things will not be relevant for you all, because in thesis protocol we don't do multi-centric research. We don't have international funding. And we don't do research in thesis which has got more than minimal risk. Even the part related to compensation and all, you should not worry about that, because I don't think any supervisor, any guide is going to give you thesis where we have to, there is a risk and we have to compensate for that. But other things that have been mentioned, they are very important. Like you have to submit the IEC form, as Dr. Priyanka mentioned. The link was given. If you have any issues, we will share it with you, that form, on your WhatsApp group also. Other thing is about the patient information sheet should be mentioned, both in English and also in Hindi, whatever is the local language of that group that you are studying. Suppose if you are studying in Delhi University students or medical students, then you only English might suffice. But if you are doing in maybe local area, or the patients that are coming from surrounding area, Shadra and or UP and all, so you may need to have both the languages where you are having the IEC form, as well as the even the questionnaire has to be in English and Hindi both, so that the consent is actually informed consent and not just like that. So thank you, Dr. Priyanka. If there are any questions,
Thank
they
you,
will
sir.
put it in the chat box.
Sir, if I have your permission, if you have time, I would like to, show a PDF of my PG's IEC form.
Please share. That will be
If
helpful.
that is possible. Sir, I'll try to do it. Sir, is it visible, sir?
Yes,
Hello?
it is visible.
So this is basically my PG's IEC form, and as I have mentioned about the checklist, so everything is there. You can see this is the covering letter. I'll just go through it very fast. This is the undertaking, basically the scientific committee, the second point I was talking about, clearance from the scientific committee. So this is that form. And then you have this IEC form where the name of the student and all the details are mentioned, title of the thesis, and the undertaking by the candidate and the supervisor. So this is the next part of that IEC form. This is the checklist that should be there, and then the ethical committee, after going through the proposal, makes recommendations regarding whether it may be approved or not. Okay. This is the form where all the different details that I have talked about are listed, and this is how you fill up your form. You have sponsored type of study. This is a clinical trial, and then you have the brief description of the proposal where you're supposed to submit the 13 copies of your research proposal. Right? So next, this is the undertaking which is done by the principal investigator. So as you have, if you recall, I have mentioned that it will very clearly state that no participant will be made to pay. The questionnaire tools are not copyrighted. So you have the permissions. You're making a statement about the permissions taken. If you're using copyrighted tools or questionnaires, and you have made another statement that no participant will pay for it. Okay. So this is the checklist for the attached documents. So this is the research proposal. So I will skip this. Then this is the PIS. Okay. So you have a brief introduction of what you intend to do, what is the purpose of the research, what is the type of intervention, how you select the participant, voluntary participation. You make the participant realize when you go through this para that you ensure that the participant in this research is entirely voluntary. Tell the participant that the participation is entirely his or her decision. Okay. So you give details about how you go about the procedure and the protocol, what will be the expected duration, the risk and benefits, reimbursement, confidentiality, and right to refuse or withdraw. Okay, all this forms a part of the PIS. Then the last is the who to contact. Okay, if you have any questions later on, so this is the person who should be contacted. So you give the details, the contact details of this people. Then the second part of this is the certificate of consent. So here the participant will, make a statement that after I have gone through the PIS, I'm making like my participation voluntarily, I'm doing it. Okay. So here you can see that if the participant is illiterate, also there is a provision for if the participant is illiterate. Okay. And this is the statement which is given by the researcher or the person taking the consent. And the same thing is in Hindi now. Okay. When you are making the, the PIS in the local language, please try to be as simple as possible. See that sometimes Google translation can create issues. Just look into it. Okay. So this is the annexure 2, which will have the case record form. That's all. So I hope that gives you a fair idea of how you fill up the IC proposal.
Yeah, thank
Sir,
you.
you can continue, sir.
Yes. Thank you, Dr. Priyanka.